Yes, hello everyone. A very good morning and welcome to the AM MedTalk sessions that we have been doing every Sunday at 11 a.m. I am Shriyal Setumadhavan, the editor of Aesthetic Medicine India, and I have been joining you every Sunday at 11 a.m. with various aesthetic medicine practitioners. We have been discussing different treatment concerns, we have been bursting myths, we have been talking about clinic management, and a lot of things. So, once again, I am back today with a very special doctor, and we are going to discuss one of the most common concerns, which is pigmentation. And what would make this interaction even interesting is that we would speak about pigmentation and boosters. So, I have Dr. Amisha joining me live from Surat, and I can see she's already joined the live. So, Dr. Ami, I'm just sending you an invite live with me. Yes, and the Aesthetic Medicine India latest edition is out. So do not forget to download your copy. Very soon you're going to see it on the bio link of our Instagram page. Else you can log on to our website, which is Aesthetic Med India, and you can get your copy from there. Dr. Ami, I have got your invite as well. I have added you in. So Dr. Ami should be with us soon. But yes, we've also announced the dates for the Aesthetic Medicine Conference and Exhibition 2025. We are all geared up to bring something new to you in the sixth edition of our conference and exhibition in India. Of course, those of you who have been following us regularly, you would be aware that we have been in the UK market for more than 20 years now. Okay, for some reason I'm getting a notification that Dr. Ami is unable to join. Wait, let me take a second and join her in. But yes, in the meanwhile, for all of you who have joined me, I would like to know from you. Yes, Dr. Ami is here.
Yes, hi Shriyal. A very
Hello,
good morning.
Dr. Ami. A very good morning. How are you doing?
I'm good. Looking forward
Instagram can give me
to this.
surprises despite trials.
Yes,
Great, great. So I'm looking forward to today's AM Med Talk with you.
yes, me too. Looking
Yes.
ahead for this interesting discussion.
Absolutely. So I was telling everyone who's, already joined us live and watching us that Dr. Ami and I are going to be discussing pigmentation and boosters. And of course, I have come with a set of questions for her where we would be discussing a few more, we would go into the details of few more things. And it's all in my questions. So, I think Dr. Ami and I have interacted very closely over the last few years. She has regularly been at our Aesthetic Medicine India conference and exhibition in Mumbai that we organize every year. And Dr. Ami, next year our dates are out. It's going to be May 17th and 18th.
Okay, so see you in Mumbai.
Yes. So please block your calendar, and I would look forward to seeing you in Mumbai. And a quick introduction to Dr. Ami. She is the dermatologist of Shah Skin Clinic and Laser Center. She's based in Surat, Gujarat, and she is joining me live from Surat today. So, without any further delay, I'm going to go straight into my questions. And for those of you watching us, please take complete advantage of this opportunity that we have with Dr. Ami. You have the comment section. I have kept it open for you, so feel free to add in your comments, ask questions, give us your reactions, and be a part of the live equally with us. So, having said that, Dr. Ami, are we ready to get started?
Yes, of course.
Yes. So, as a dermatologist, I'm sure that pigmentation is a very common concern that you address among your patients. And if you can begin with telling us that what are the most common causes of pigmentation and how do you typically approach treating it?
Yes, pigmentation is definitely a very common condition that we face since we have started practicing, and a very challenging treatment and approach is required because pigmentation is, of course, seen as brown patches on the skin. So for the patient, it's everything is just hyperpigmentation, but the causes are so variable. Commonly, the most common cause that we see is, of course, acne, resulting into post-acne hyperpigmentation. But there are other conditions which are hormonal. Like one can see melasma, 80% of the females present with melasma, and uncommonly seen in males also, which is about 20%. So melasma is really a very challenging pigmentation for the most senior dermatologists also because the condition itself is so difficult to treat. It depends so much on the intrinsic factors. Then we have autoimmune conditions which present as pigmentation. So for the patient, it could be just as I'm getting darker or I'm getting, tanned, but it is not a tan. It is basically an autoimmune condition, something like lichen planus pigmentosus, which is so common nowadays. So it is a dermal pigmentation which is going deep into the skin. So there the approach is going to be different. Then there are conditions like uneven skin tone because of dehydration in the skin, photoaging, insulin resistance, which is so common nowadays, polycystic ovarian disease because of lifestyle. The obesity is the main, factor now playing a role in so many human beings. So because of that, insulin resistance, the high insulin in the body eventually stimulates your melanocyte stimulating hormone, and that stimulates pigment. The typical pattern is around the eyes, around the lips, on the cheeks, stubborn dark pigmentation, neck, the folds, underarms. So this is so commonly seen not only in elderly but a very common condition in young individuals. That is what we are
Hmm.
seeing.
Hmm.
Then we have this frictional melanosis, atopic dermatitis with so much of itching on the face, itching on the body, and eventually resulting into hyperpigmentation. Then amyloidosis is a condition where patients are using loofahs or rubbing on the body with towels, and that results into a frictional melanosis, which is called as amyloidosis. So, of course, hyperpigmentation for the patient is brown patches or dark patches. But it's the doctor's duty to understand what the pigmentation process is going on and explain to the patient that eventually helps us to treat the problem really very well.
Great, great. I think that was very comprehensive for us. And if you can also add here that how do skin boosters help in, improving pigmentation issues, and can these be used in, combination with other treatments?
Yeah, so basically, what are skin boosters that all the patients should know, first of all? So, boosters are a combination of products like hyaluronic acid. That boosts the collagen, that boosts the elastin. Then we have glutathione in the skin boosters. Then we have the latest in the basket is the polydeoxyribonucleotides, the NCTFs. So these are the ingredients or these are the medicines, I would say, that eventually results into improving the skin quality, basically.
Hmm.
So there are some ingredients like hyaluronic acid, collagen, elastin. These are adding health to the quality of the skin. And there are certain boosters which contain the polydeoxyribonucleotides. These are anti-inflammatory in nature. So there are so many pigmentations which are going on as an inflammation process in the skin, like melasma, like lichen planus pigmentosus. So when these boosters are added, they create a atmosphere of anti-inflammation in the skin,
Hmm.
and thereby they help the pigmentation. So they have got a definitely strong role in treating the pigmentation. And they also have glutathione, which is everybody knows it's now that it's a very powerful antioxidant, so helps pigmentation. So per se on their own, they cannot do everything. So it's a combination of treatment that works. So first the diagnosis, why the pigmentation has happened, plus adding skin quality will eventually allow the other medications, the other treatments to work more effectively when the skin quality is also improved because of the skin boosters. So that is how in combination it has got an excellent role.
Right, right. I'm sure as a dermatologist, and I think you and I have discussed this before as well, that we don't have a one treatment fits all kind of an approach. And as a dermatologist, you would always customize your treatments. So when we speak about, pigmentation treatment plans, any specific factors that you take into consideration while customizing these for different skin types?
So first the diagnosis and the level of the pigmentation, whether it is epidermal or dermal. So we in our clinic, we have got a very specific protocol that every hyperpigmentation is addressed by doing a dermascope. So when we do a dermascope, we are very clear of the internal picture that's going on in the skin. So whether it is an inflammatory in nature, whether it is frictional, whether it is acanthotic, whether it is simple post-traumatic or acne pigmentation, so
Hmm.
everything is very clear in the picture. So then the patient is explained that this is the process that's going on in the skin. So according to that, the medical line of management is going to be this. And to add, medical line of management in skin has got a limitation. So everything cannot be improved just with the medicines. So definitely over the years, I mean, I have been practicing over more than 23 years now, and it's been a journey. So we have seen chemical peels earlier, we have seen lasers later on, and now the skin boosters. So eventually, when we understand a combination of treatment is going to work, so we explain that, these are the three things which are going to work for you. And according to the patient's approval, we start with one by one or together, depending on the approval and, of course, the budget of the patient. So, because everything naturally, because to treat, we need three things, but three things have also got their own cost.
Of
So,
course.
yeah, but see, when a patient knows that I need these three things or I could be needing these three things, mentally they are aware of what is going to happen with them. They are ready for things either together or one by one. But when you have an understanding, the compliance of the patient is very good. The understanding of the patient is very good, and we can hold on to our patients for a very long time with very satisfactory results over a period of time.
Nice, nice. Specific to acne, we see that acne often leaves behind pigmentation marks. So, how do you treat both active and post acne pigmentation effectively?
Yeah, so acne, see, patients generally, when they have those comedones or submerged comedones within the skin and not on the surface, they avoid visiting a doctor, most of the patients. So, eventually, what happens is when it comes onto the surface, and that's the time they come to us. So, when the acne is already on the surface with a lot of inflammation, it is going to definitely deal with some consequences. So we see a post-acne hyperpigmentation, a post-acne erythema, or in severe cases, a post-acne scarring. So
Hmm.
when they come to us, we are dealing with the active acne itself, for which the medical line of treatment is important, and also we are dealing with the consequences. So therein comes the role of the combination treatment. So if we don't see any consequences like pigmentation, like scarring, probably only medical line of management with antibiotics or oral isotretinoin with topical creams could help. But when we see the consequences which are really deep, we need to take assistance of the combination treatment like lasers, chemical peels, and to some extent in some patients skin boosters also, and advanced treatments like microneedling RF or dermapen or PRP.
Right, and I think you've almost answered my next question, which was more about how the treatments for acne have evolved and where do skin boosters fit into the whole
Yeah,
line of treatment, over here.
correct.
So I think you've
So,
answered that. I'll quickly, actually, before we both continue, we have a question from Dr. Urvija Jain. So I'll
okay.
quickly take that
Hi, Dr.
question. Her
Olivia.
question is that Q-switch laser, do they work in pigmentation or only pico laser is more effective and does it work?
No. Q-switch laser definitely works in pigmentation. Again, as I said earlier, the diagnosis is very important. So generally, the lichenoid pigmentations respond very well to Q-switch. The nevuses respond, nevus of Ota, or any kind of melanocytic, hairy melanocytic nevus responds to Q-switch. The post-acne hyperpigmentation responds to Q-switch. The inflammatory conditions like melasma may not be doing so well with Q switch. So the number of sessions may vary, Q switch and pico laser. But of course, Q switch, I've been using it for more than 14 years now, and it has cleared so many of my lichenoid pigmentation patients reasonably very well.
Also, we have a question from Dr. Kashanu that what supplements do you recommend for pigmentation?
The patients, of course, supplements like the basic parameters have to be really good, like B12 is very important, vitamin D, vitamin C, and glutathione is something which we are, and antioxidants we add to the prescription. The oral antioxidants like astaxanthin, vitamin C, glutathione, these are vitamin B12 deficiency results into hyperpigmentation. So these are the things which really help.
Thank you so much. doctors. I hope we've answered that for you, and keep the questions going. We would love to take more of them. But I'll go back to my question for now, Dr. Ami. Yes, we were talking about how do skin boosters fit into the treatment options for acne, and how have these overall treatment options, evolved over time?
So skin boosters, how did they come into picture? Like basically, it was that the improvement is there in the skin quality, as I explained earlier also. Every disease has its own pathology, but the disease is happening in the skin. So, like for example, I'll tell you that when we are exercising and we are working out with our muscles, of course, the general health of the body is so important. So, if you are working out with some 10 kgs or 20 kgs, and if the muscle is not having that enough protein, the guide is going to tell you that we need to increase your protein supplement so that the muscles can perform better. Same way in treating skin disorders of hyperpigmentation, the basic quality of the skin is so important to give a response to the treatment that we are giving. Suppose I'm
Mm,
doing a laser treatment, or I'm giving a medical line of management for some lichenoid pigmentation or some melasma. If the skin is dehydrated, lack of collagen, lack of elastin, lack of hyaluronic acid, the response of that skin is going to be slower than the better skin. So when we see such compromised skin, we add skin boosters to the skin to promote some growth factors so that the response to the medical and the laser line of treatment is going to be better. This is the first rule. Second role is when we add skin boosters like polydeoxyribonucleotides and CTVF, which has got glutathione in it, which has got hyaluronic in it, which has got these anti-inflammatory agents in it. They itself have a role to reduce the hyperpigmentation because of its anti-inflammatory nature. So depending on the case, we select a booster. Now it's been a journey. I'm injecting skin boosters since 2008. It all started with hyaluronic acid as a simple ingredient, and now we have got so many combinations, so many different skin boosters. So learning, it has been a learning curve and journey. So now the patients, whenever the patients step in and we have to guide for the skin boosters, we as our clinic and me knows that okay, for this patient this is going to be the best skin booster, which is going to help her condition as well and her other concerns. Otherwise, what will happen is because of that, now we know there is a bunch of skin boosters. Earlier, we must have done some skin boosters with had only hyaluronic, but now we
mm,
have the combination, so we are able to give better results in the first group. So that has made life easy for us and patients too.
mm. I'm taking a question again from the comments, at which peels are good for pigmentation.
Yes. So depending on the cause, generally for post-acne pigmentation, I like a combination of salicylic and mandelic acid, which treats the acne and the pigmentation definitely, or salicylic. And when the acne is under control, it is just the post-acne pigmentation. Then we select either a combination of glycolic and kojic acid with mandelic acid together. So these are the peels, and even to some extent, yellow peel works for. I generally avoid doing a yellow peel when it is active acne with pigmentation. More reserved for photo aging or the uneven skin tone type, where I prefer doing a yellow peel.
Uh, Aisha has a question for us that can you explain the role of CO2 laser in hyperpigmentation?
Very deep dermal pigmentations. For example, lichenoid pigmentations. And we have to be very careful when using a CO2 laser because it could even trigger a pigmentation. So basic skin quality is very important when you're dealing because eventually CO2 laser can result into a PIH and aggravate the condition. So post care is very important. So for me, CO2 laser is going to be used only in 20% of my patients. Most of my patients are not going to be used with CO2 because it's really very tricky and to go ahead with a CO2 laser for pigmentation.
And Dr. Urvija has one more question, that does PRP help in pigmentation?
Yes, PRP helps a lot in post acne erythema. I've seen a very good role of PRP, and the more advanced form of PRP, that is GFC, which I use commonly in my practice for melasma. And there are good results and good outcome. We even performed a study of over 30 patients where we saw definitely a role of GFC That is, of course, the advanced PRP in treating melasma. Again, the reason being the growth factors are going to help improve the skin quality, and thereby the response to your treatments is going to be better.
Right, right. Going to one of my questions before I lose track from here as well, that you were mentioning glutathione in our conversation. We've come across the term a couple of times. IV glutathione is often talked about for its skin brightening effects. What are your thoughts on its effectiveness, especially in treating pigmentation?
Yeah, so IV glutathione or oral glutathione, first to mention, is a very powerful antioxidant. So basically, we have been producing by our liver. The glutathione is as hyaluronic is our content of the body, glutathione is also an important content of our body. But as we age, this level of glutathione depletes. So, what is glutathione doing? Basically, it's a very powerful antioxidant. So, when we are stepping out in the external world, the oxidative damage that is happening to our body, the skin, is managed or is balanced by this glutathione. So when we add glutathione to the skin treatments, we are adding an antioxidant basically. It doesn't have,
Hmm.
and also it has got a role to reduce the pigment by its antioxidant property to some extent. So it is more a brightening agent because it is not allowing your body to get affected because of the oxidative stress that is happening. It cannot be an effective treatment. Don't call it as a treatment of whitening or depigmenting. Then you will be, it is overhyped basically. And especially you will see that non-dermatologists, the clinics that are run by the non-dermatologists are promoting it too much, right?
Hmm.
So basically, if I have taken care of all the etiologies, I have taken care of the diagnosis that why this pigmentation has happened, I have treated it medically, I have added skin boosters, I have given a good solution. And if I add a IV glutathione, so that the patient's body has become more stronger or powerful to fight to the oxidative stress, giving them a brighter complication and justifying the treatment. But if I have a case of melasma in front of me and I'm promoting my IV glutathione just considering that it's going to deal with the pigmentation, I'm wrong. So it is very important to understand for the patient, especially, that what are you expecting? I see some patients coming to me. The doctor, I took IV glutathione, but it didn't give any kind of results to my pigmentation. The pigmentation is still lying there. Or it was told to me that it's going to be boosting up my collagen or boosting up my hydration in the skin. No, that's not what glutathione does. It's just an antioxidant. We have to respect that and take advantage of it as an additional treatment in your treatment plan.
Hmm.
So one
Hmm.
can expect a little bit of brightening with it as long as you take it. The day you stop it, probably you need more. So you keep on doing it. So one has to understand why you are doing an IV glutathione. So there are very selected patients, which we see in our practice. Yes, this is the patient who needs an IV glutathione to add to a treatment, and we put them on it. It's not for every patient walking in your clinic that you offer an IV glutathione.
Are there any potential side effects associated to it?
Some the most common thing that one should consider when giving an IV glutathione in the clinic is an allergic reaction.
Okay.
So whenever you take an IV glutathione, it has to be a doctor first of all at a place there. Secondly, the crash tray that is in an emergency, what can be needed should be available right there because you don't know when that reaction can happen. It is generally allergic reaction resulting into hives or itching or something. And toxicity is very rare because only if somebody is not supervised and just keeps on taking IV glutathione on their own with non-dermats, and that results into a toxicity, that is something different. But that should not happen if you are doing it under a doctor, a dermatologist, and who is supervising
Expert
your
supervision.
correct. Yeah.
Right. We have a common question from Dr. Rishika Jaiswal and Dr. Urvija Jain. Their question is that does tranexamic acid tablet work in pigmentation and melasma?
Yes. So that there comes in the role of the inflammatory conditions. So inflammatory conditions, whenever, that's why dermoscope becomes very important. So the moment I see an inflammation going on in the skin, and when we add on tranexamic acid as an anti-inflammatory agent, the response of the patient changes. The treatments become more effective. So definitely. oral tranexamic acid has a role, and so select your patients and then go ahead.
There's a question on glutathione. If you are able to understand, I'll read it out exactly how it's come. That glutathione withdrawal reverse pigmentation.
See, it's not glutathione withdrawal reverse pigmentation.
Hmm.
Again, you know, glutathione, if it is added as a brightening agent, it is going to brighten up your skin. Now, over a period of time, your body is not producing so much of glutathione, and you have added that extra glutathione. So its effects are weaning off. So probably you need it extra again after a few months to have the same look or the same brightening that you had earlier. But if the purpose was started glutathione with understanding the disease that is going on, which is resulting into a hyperpigmentation. So if I have treated my melasma well, if I have treated my patients lichenoid pigmentation very well, and even if I don't give a IV glutathione, the patient is sorted with the other maintenance treatments. But if
Right.
I have just given IV glutathione, then naturally the reversal of the pigmentation is going to happen, because at first place the pigmentation was not treated properly.
Hmm. Hmm.
Any
Uh,
pigmentation maintenance is very important.
yeah.
So one needs to maintain. So we can come to that question also, so that patients understand.
Sure, sure. Also, we have a follow-up question from Dr. Rishika to your response on tranexamic. That can you suggest any doses and how many days can the doctor prescribe it?
So generally, we start with 250 mg twice a day, one after lunch and one after dinner. And 3 to 6 months is a good time that a patient can continue. One has to rule out the contraindications of tranexamic acid in that particular patient, asking a history of any clotting mechanism or any other, significant history. And once you start the tranexamic acid, minimum 3 months. I extend my patients up to 6 months. And in very stubborn cases of melasma, we even give short, sequential, like Saturday, Sunday, or weekend dose for a little longer time, weaning off the patient for 3 to 4 months and then restarting again. This is how we can manage our patients individually.
Dr. Santu has a question for us. That does mesotherapy with transexamic, will that be helpful for melasma?
There are not enough studies which promote it, but when the patients are not ready for injectables or skin boosters, and you want to add something, I would still prefer nowadays. I prefer doing a mesotherapy with polydeoxyribonucleotides rather than doing tranexamic acid, because I'm finding it really worth it. Oral tranexamic acid that works, not injectable or topical. Injectable is, of course, very painful, but in diluted doses, in the past, we did some patients on injectable tranexamic acid showing a response, but of course, it is really painful. So nowadays, we have shifted it to polydeoxyribonucleotides. But yes, injectable tranexamic acid has a role. Mesotherapy, I'm not sure.
Okay. Dr. Ami, from there, I'm very interested to touch upon this topic. I recall you mentioning to me that you use Juvena in your clinic, and it works very well in as a non-invasive skin tightening solution. So, can you share a little more with us about, the device and what skin concerns can it address?
Yes, of course. So now skin aging, when we comes to skin aging, it is basically the muscles and the skin itself. The volume loss or the collagen content in your skin, which is in the epidermis, the dermis, and the fat in your, subcutaneous tissue. Then comes your muscle. Then beneath the muscle is again a deep layer of fat, and then there is your bone. So this is how we are structured. So when you see a volume loss, a considerable volume loss, the first thing that you come to understand is I need a filler, or I need to inject this patient with a volume replacement, which comes with a hyaluronic acid syringe that we are all doing over years. Now, but there is also a component of muscle which is working. There is a thinning of the muscle happening. The muscle is getting degenerated. And because we are losing the volume loss of the muscle, we are seeing some volume depletion and aging. Now, so the approach has to be whether you need an injectable or you need an RF with a muscle stimulator. So Juvena is a device which has RF radio frequency, which is going to boost up the collagen and help in skin tightening. So RF is like over more than 2.5 decades now that we have been using RF for skin tightening. This device is skin tightening with RF plus a diathermic contraction of the muscle. So the lifting muscles of the face, like the risurus, the zygomaticus major, and the minor, these are the muscles which lift us from here. So when we work on this lifting muscles with this device, we are giving a cellular correction which is going to work for a longer period of time. Then the frontalis, which is helping to raise your eyebrows. So when we work on the frontalis, it is a eyebrow elevator. So depending on the patient's need, we select the different muscle groups and we stimulate those muscles along with RF, giving a very good regeneration. So
Hmm.
without adding any external injectables, if I want to regenerate a face in terms of the skin collagen and the muscle volume, it is an excellent device. So when the patient's journey of aging has started in the mid 30s or early 30s, that's the time, if you start using a Juvena, you are actually regenerating your muscle, your skin, which is going into a degenerative phase. So a natural degenerative process, like how you're exercising, and trying to keep your muscles toned. So same way, a device which is doing a regeneration for naturally is Juvena. So the advantages are the patients who are not ready for injectables, at least we are doing some regeneration in these patients, plus the patients who are ready for injectables but are needing a huge amount of volume of fillers, maybe 6 ml, 8 ml. And then when we start the patients, we guide the patients that first go in for Juvena so that we are building up some volume, some regeneration. And then whatever needed, we add a injectable that is going to limit the number of ml needed in that patient. So,
Hmm.
so
And
basically,
can this
so
be combined with the pigmentations, treatments, and skin boosters?
So per se, Juvena is not a depigmenting treatment. So I cannot
Okay.
promote it as a depigmenting agent. But what is happening is a lot of blood circulation is improving to a great extent. Plus the muscle is getting contouring, a volume, and it's regenerating. Plus the skin is regenerating. So something similar to when you are adding a skin booster is happening. Skin booster is also improving the collagen. Skin booster is also improving the quality. So Juvena is also doing the same thing. So when we are doing Juvena with your depigmenting treatment and a booster, a combination treatment is helping to regenerate the skin of pigmentation also. But again, the diagnosis is important. It may not help all the pigmentations, but yes, the pigmentations which are more obvious because of compromised skin quality, dehydration in the skin, definitely help with Juvena.
We have a question if there are any side effects for Juvena and what is the downtime?
No downtime. That's the best part in my practice. And no side effects because it's naturally
Wow.
regenerating the muscle. When we are doing it for very weak muscles, so when we are stimulating them, the patient feels a little, discomfort when we are doing it. Like how you work out with your biceps and they are sore for a day. Same way, when we are working out on your zygomaticus major, the patient might feel a little. But to our knowledge, when we do 6 to 8 sessions for these patients, when they come for a maintenance session after 6 months or 9 months, saying that the results lasted so long, I have a lifted face, I want to do a maintenance session, and that time when we do a Juvena, the discomfort is not there at all. That means that gives us an idea that the muscle which were so weak, so degenerated, have achieved a good amount of regeneration, and now they are able to take the same power so well because they have been trained by the
Hmm.
device. So
Hmm.
this is how it makes us also understand that the weak muscles have become stronger and now they are lifted.
Hmm. So, Dr. Ami, a lot of patients, I believe, would want to avoid injectables and more invasive procedures. So, if you have to just share with us, what would your top picks be, 3 to 4 picks, and the best non-invasive options available for pigmentation and skin health? What would these be?
So invasive, you mean even only injectables or even lasers?
No, lasers, we could take them in
Could take as
non-invasive.
non-invasive,
Yeah.
correct. So pigmentation, hyperpigmentation, of course, the lasers are the gold standard. So skin boosters is an additional help. It is a
Mm.
combination of treatment. So it's not again the first line. If I do a booster and I don't do my IPL for my melasma, or if I don't do my Q switch or Pico for my lichenoid pigmentation, it's not going to work. So per se, non-invasive treatments, medical line of treatment, if it is a lichen planus, I need to put him on a oral cyclosporin or a Dapsone, my medical line of treatment, plus my laser to remove that pigment out, or in melasma to give a IPL. So non-invasive lasers are also number one. So even when I customize my patient or set a protocol for them, I would put it as number one is my medication. Number two is my number one is my prescription. Number two is my laser, and number three to add on to the effect is a skin booster or a PRP or a GFC to add.
And I think a very important point that you touched upon was maintaining the results and how critical the maintenance part is. So, how can patients maintain their results of pigmentation treatments and skin boosters in the long term? And are there any post treatment care tips that you would like to recommend?
Yes. So when the patient comes to me on the first day, the consultation itself talks about maintenance. So all is in vain if you are not ready to maintain. So basically, we can all the diseases. See, it's not a viral infection, or it's not a malaria, or it's not a bacterial infection that once you solve an antibiotic with an antibiotic, it's not going to recur again unless you catch up with an infection again.
Right?
How many patients of diabetes say that my diabetes is cured, or my BP is cured, or my thyroid is cured, right? So these are the diseases which are intrinsic, connected with your body. So your doctor tells you that you need a lifelong medication and a lifelong lifestyle changing, right? Similarly, most of the skin pigmentations are intrinsic. If you consider simple post acne pigmentation, once the doctor clears, if the acne occurs again, which is possible because acne is hormonal, acne is your lifestyle, acne is your metabolism. So if you are not maintaining your acne, getting back the acne, the pigmentation is going to come back.
Hmm.
Melasma
Hmm.
is hormonal. Lichen planus is autoimmune. So these autoimmune disorders are also going to be within you, but you are controlling them with the medication and the line of management the doctor has designed for you. So once the diseases are under control, you are seeing the pigmentation going, it is very important to understand and accept that you are going to need a maintenance session. See the doctor once. The protocol that we set is come once in 2 to 3 months, so that we understand. We do a dermascope. You are reassured again that it is better. Please continue with your sunscreens. Please continue with your night cream that we have given it to you. Take the help of the little bit of non-invasive procedure that you need. Yearly skin boosters. So these are the things that are going to keep your skin alive and sorted with your pigmentations if you're going to maintain it. So very important to maintain. It is the limitation of science or the limitation of the disease that we need to maintain. It's out of anybody. Anybody needs to maintain.
Right, right. Thank you so much, Dr. Ami. And I know there are more questions coming up, but I think I have exhausted the time that I had blocked on Dr. Ami's calendar for today. And of course, it's a Sunday, so we all deserve to have the Sundays to ourselves as well. But for me, it's always been a brilliant way to start my Sunday with the AM Med Talk. And I hope, Dr. Ami, you also had a good time joining us on this live.
Yes, Shriyal, thank you so much. It was wonderful interacting to you. Your questions were amazing and I loved answering them. And I hope it has been helpful to the viewers. And we can, later on again, the same interaction we can post so that the
Yes.
people who have missed attending this can go ahead with these
Yes, yes, yes,
interaction and help
absolutely.
them. Yes.
Yes. So I think for those who missed or those who joined in between the live, this live is going to be saved. It's going to be available on the Aesthetic Med India page as well as Dr. Amisha's Instagram page. And thank you, doctor. So everybody watching us who found this live helpful, and we are going to continue with the AM Med Talk. Feel free to connect with me and my team through our Instagram page. Let us know what topics you want us to cover, which doctors you want us to go live with. If you want to join me on a live, let us know. We were very active on our Instagram page and we would respond to you. But for now, I would let Dr. Ami leave for the day. Thank you so much, Dr. Ami, once again. And I would look forward to meeting you soon. in Mumbai, Surat, or anywhere across the country.
Thank you, Shriyal. Thank you, my Insta family, and take care. Have a great Sunday. Bye.
Bye. Bye.